If you've ever WebMD'd a headache and convinced yourself you had a rare tropical disease, or if your smartwatch has ever passive aggressively suggested maybe take a walk, don't worry, you're not alone.
Welcome to AI Explored. AI Explored.
Greetings, listener, and welcome to another thought-provoking episode of AI Explored, the human's guide to the future. I'm your host, Jeremy, a confirmed human. Well, at least according to my medical records and the occasional CAPTCHA test. Also, I'm someone who still insists on asking doctors questions, even when AI already predicted my sore throat was just from yelling at my computer. AI is stepping in as a doctor's digital assistant, a researcher's tireless analyst, and sometimes a patient's best friend. But with great power comes great, well, and a few ethical dilemmas. Can AI diagnose diseases better than doctors? Can it create personalized treatment plans? Is your smartwatch secretly judging your pizza consumption? Well, we're about to find out. So whether you're someone who Googles every symptom just in case, or a seasoned medical professional curious about the latest AI breakthroughs, today's journey into AI-driven healthcare has something for everyone. Strap in, adjust your headphones, and prepare for launch. Our mission to demystify AI starts now. First things first, let's establish what we're dealing with. AI in diagnostics is like having a doctor who never sleeps, never takes a coffee break, and has read every medical journal ever published, except it still occasionally confuses a tumor for a smudge on the scan. For decades, diagnosing diseases has relied on trained medical professionals analyzing scans, symptoms, and test results. It's a system that works, but it takes time, is subject to human error, and requires extensive experience. AI is stepping in to enhance, not replace that process, at least not yet. Take radiology, for example. Medical imaging produces massive amounts of data that radiologists must analyze. AI can scan these images faster than any human, identifying early-stage tumors, fractures, and hidden anomalies. In some cases, it's even more accurate than traditional methods. Google's DeepMind AI, for instance, can detect over 50 eye diseases from retinal scans with a reported 94% accuracy. That's outperforming many specialists. It's not just radiology. AI is making waves in pathology too. Systems like Path AI and Page AI have been trained on millions of pathology slides, helping them detect subtle patterns in tissue samples that even the most experienced human pathologists might miss. And then there's predictive analytics, using AI to analyze massive medical data sets and spot the likelihood of disease progression before symptoms even show up. Researchers are already working on ways AI can detect Alzheimer's years before memory loss begins. Imagine that. But before we declare AI the ultimate diagnostic tool, let's pump the brakes. Because while AI is incredibly powerful, it's not perfect. And when it makes mistakes, the consequences can be serious. There have been cases where AI models trained to detect skin cancer were far less accurate in diagnosing darker skin tones. Why? Because the data used to train them didn't include enough diversity. That's a serious problem. If AI isn't trained on a broad enough data set, it can lead to misdiagnoses and biased results. And what about when AI incorrectly flags a condition that isn't there? Or worse, when it misses something life-threatening? This is where the balance between AI and human doctors matters. AI works best as an assistant, not as a replacement. Many hospitals are now using AI as a second opinion, an extra set of digital eyes to confirm what a human doctor sees. And it turns out that's when AI is most effective. Studies have shown that AI-assisted diagnostics, when used in collaboration with human doctors, can reduce medical errors by up to 30% in some fields. That's a big deal. But here's the big ethical dilemma. If an AI misdiagnoses a patient, who's responsible? The software developers? The hospital? The doctor who relied on AI's recommendation? The answer isn't clear, And that's why AI healthcare needs strict regulations, rigorous testing, and constant oversight. Because in medicine, a small mistake isn't just an inconvenience, it can mean life or death. This is where we have to get it right. AI in diagnostics has enormous potential. It's already helping detect diseases earlier, assist doctors in making better decisions, and increasing efficiency in overwhelmed healthcare systems. But if we don't ensure that it's being trained properly, tested thoroughly, and used responsibly, we risk putting too much trust in a system that isn't foolproof. So, will AI replace your doctor? No. But could it be the extra set of eyes that catches something early, saving you a trip to the ER? Absolutely. And that leads us to our next question. If AI can help diagnose diseases, can it also help create personalized treatment plans? The answer might surprise you. Let's get into it. Let's get something straight. Medicine has never really been personal. For the longest time, treatments have been prescribed like they're coming off an assembly line. Got high blood pressure? Take this. Got cancer? Here's the standard chemotherapy regimen. But let's be honest. What works perfectly for one person might not do much for another. And that's where AI is stepping in to change the game. Imagine walking into your doctor's office and instead of flipping through a medical chart and guessing which treatment might work best, they run your entire genetic profile through an AI model. That AI doesn't just compare your symptoms to a general population, it cross-references them with millions of cases, your DNA, your metabolic rate, even how your body processes specific medications. The result? A treatment plan that's tailored to you, not just someone like you, but you specifically. We're talking about precision medicine. This is the idea that instead of a one-size-fits-most approach, AI is helping doctors craft a healthcare plan as unique as your fingerprint. Take cancer treatments, for example. AI-driven platforms like IBM Watson for oncology can scan through mountains of research papers, clinical trials, and real patient data to suggest the most effective treatment for a specific patient. And it's not just about picking a treatment. It's about optimizing dosages, minimizing side effects, and predicting how your body will respond before you even take the first pill. But AI isn't stopping there. It's also helping with drug discovery, shortening the process of developing new medications from decades to just a few years. By analyzing countless chemical compounds and running virtual simulations, AI can predict which ones are most likely to work against the disease. Instead of trial-by-error testing in a lab for years, AI can identify promising candidates in a fraction of the time. That's not just impressive, it's potentially life-saving. And then there's the field of regenerative medicine. Scientists are now using AI to analyze how different genes interact, which could eventually lead to AI-designed gene therapy tailored to repair damaged tissue, reverse genetic disorders, or even slow down aging. We're talking about treatments that could be customized at the cellular level. Sounds incredible, right? But before we get too excited, there are challenges we need to talk about. First, accessibility. AI-driven personalized medicine is expensive. Some treatments can cost hundreds of thousands of dollars. Will only the wealthy have access to life-saving customized treatments? And if insurance companies start demanding genetic testing before covering certain treatments, what happens to patient privacy? These aren't small concerns. And let's not forget, AI is only as good as the data it's trained on. If that data is incomplete, biased, or flawed, the treatment recommendations could be flawed too. That means doctors need to stay in the loop, ensuring that AI is being used as a tool, not as a decision maker. For now, let's appreciate the fact that we're heading toward a future where doctors might actually say, here's actually what you need, instead of, let's try this and see what happens. That's a future I can get behind. So, AI can diagnose you. It can even craft a treatment plan tailored just for you. But what happens next? Healthcare doesn't stop at treatment. It's an ongoing process. And AI isn't just here to help when you're sick. It's watching all the time. All right, maybe that sounds a little too ominous. But AI-powered patient monitoring is one of the fastest growing areas in medicine. Think about how many people already use smartwatches or fitness trackers to keep an eye on their heart rate, sleep, or stress levels. That's just the tip of the iceberg. AI is stepping in to help track chronic conditions, predict health issues before they happen, and even keep patients safe after surgery. Take wearable devices. If you have an Apple Watch or a Fitbit, you've already got a little AI assistant tracking your vitals. But now, AI is taking that to the next level. It's not just collecting data, it's analyzing it in real time. Devices like the KardioMobile can detect arterial fibrillation, a serious heart condition, before you even feel symptoms. AI powered glucose monitors for diabetics can predict blood sugar crashes before they happen, and smart patches can continuously monitor everything from hydration levels to oxygen saturation, giving doctors real time insights into a patient's health without them stepping foot in a hospital. A little scary. But it doesn't stop with wearables. AI is also being used in hospitals for continuous monitoring. Instead of nurses checking vitals every few hours, AI powered systems like EarlySense can track a patient's heart rate, breathing, and movement every second without even touching them. These systems can detect subtle changes that might indicate complications long before a human would notice. This means fewer emergencies, faster interventions, and potentially a lot of lives saved. And let's talk about virtual health assistants. AI powered chatbots and voice assistants are being used to check in on patients after surgery, remind them to take medications, and even answer basic health questions. These systems can flag issues early and alert a doctor if something seems off. Imagine recovering from a surgery at home and your AI powered assistant notices that your pain levels are increasing and your heart rate is spiking. Instead of waiting for your next checkup, the system flags it and notifies your doctor immediately. That's where AI is making a real difference. But as always, there are challenges. First off, data privacy. These systems are collecting a lot of personal health information. Who owns that data? Who has access to it? Can it be sold to insurance companies or advertisers? These are real concerns. And then there's the question of accuracy. If an AI misreads your vitals and doesn't flag a serious issue, who's responsible? The hospital? The device manufacturer? The AI itself? These are the same kinds of ethical questions we touched on earlier, and they only get more complicated when real-time monitoring is involved. But let's end on a hopeful note. AI in patient monitoring is saving lives. It's making healthcare proactive instead of reactive, and you all know my feelings on that. It's giving doctors better insights and patients more control over their health. And yes, it might mean your smartwatch knows more about your habits than your own family. And hey, at least it's looking out for you, right? So far, we've talked about how AI can diagnose diseases, create personalized treatment plans, and monitor patients in real time. It all sounds like we're heading into a golden era of healthcare, faster, smarter, and more efficient. But there's something we need to talk about, something that isn't just a footnote in this discussion. It's the foundation of trust in AI-driven healthcare: security, accountability, privacy. And let me be clear, this isn't abstract theory to me. This is the kind of thing I work on every single day. If we don't get this right, then everything we've talked about so far could backfire in ways we aren't prepared for. Let's start with data privacy, because AI doesn't work without data. And not just any data, your most sensitive personal health data. We're talking about electronic health records, genetic information, real-time biometric tracking from wearables, and even predictive analytics that can flag potential conditions before you ever set foot in a doctor's office. AI in healthcare doesn't just need data, it needs massive amounts of data to function. And that data has to come from somewhere. So where does it go? Who has access to it? Who profits from it? These questions don't have simple answers, and that's a problem. Right now, hospitals and healthcare providers are partnering with tech companies to develop AI-driven diagnostic models, predictive analytics, and automated decision-making tools. But what happens to the patient data that fuels these models? In many cases, patients don't even know their data is being used to train AI systems. There have already been lawsuits against companies for collecting and using healthcare data without proper patient consent. If AI is trained on your health records, should you have a right to know? Should you have a right to opt out? These aren't hypothetical questions. These are real world issues happening right now. And then there's security. I cannot stress this enough. Healthcare data is the prime target for cyber criminals. It is more valuable on the black market than credit card numbers. The average ransomware attack on a hospital cost millions of dollars, not just in direct damage, but in lost time, patient delays, and critical systems going offline. Now, introduce AI into the mix. What happens when an AI-driven system that hospitals rely on gets compromised? What happens when AI models are poisoned with bad data, causing misdiagnoses at scale? I'll give you a terrifying but real example. There have already been demonstrations of how attackers can manipulate AI models using adversarial attacks, small, imperceptible changes to data that cause AI systems to make catastrophic errors. Imagine an AI system that's supposed to detect early stage lung cancer being tricked into ignoring tumors, or worse, flagging healthy tissue as cancerous. If that happens on a large scale, the damage is irreversible. And this isn't just theoretical. These types of vulnerabilities are actively being researched and exploited. And then we have the issue of AI bias. AI models are only as good as the data they're trained on. And if that data is incomplete, biased, or unrepresentative, the AI will inherit those flaws. We've already seen examples where AI diagnostic models underperform for certain populations because the training data wasn't diverse enough. If an AI model is being used to assess risk factors for diseases, but it was trained mostly on data from one demographic group, it could miscalculate risk for millions of people. That's not just an algorithmic oversight, that's an ethical failure. But the biggest question in all of this is accountability. When AI systems make mistakes, who is responsible? If a human doctor misdiagnoses a patient, there is a clear legal pathway for addressing that mistake. But what happens when AI misdiagnoses a patient? Is the hospital liable? The doctor who relied on the AI? The software company that built the model? The data scientists who trained it? Right now, we are operating in a regulatory void where these questions do not have clear answers. So what do we do about it? First, transparency. AI in healthcare cannot be a black box. If an AI model is making medical recommendations, doctors and patients need to understand why. AI decision making needs to be auditable, explainable, and reproducible. Second, data protection. We need stricter policies on data encryption, access controls, and patient consent. No patient should unknowingly contribute their health data to an AI model without explicit, informed consent. Third, regulation. Right now, AI in healthcare is operating in a regulatory gray area. Governments and industry leaders need to establish clear legal frameworks that define who owns medical data, how AI should be tested before deployment, and who is responsible when it fails. And then there's the question of risk acceptance. Every organization using AI in healthcare is making calculated decisions about what level of risk they're willing to accept. But here's the issue. Many of them are accepting risk without fully understanding it. Just because an AI vendor says their model is secure or compliant doesn't mean it's been thoroughly validated. How are hospitals testing the AI models they're using? How are they verifying that their controls are actually protecting them the way they think they are? Most organizations have some form of security framework in place, HIPAA, SOC 2, high trust, but these frameworks were never built with AI in mind. Are hospitals conducting regular adversarial testing on their AI systems? Are they simulating attacks to see how resilient these models are? Most aren't. That needs to change. But here's the thing. AI in healthcare is a force multiplier. It can catch things that humans miss, assist doctors in making life-saving decisions, and create efficiencies that benefit both providers and patients. But it has to be done right. AI should be a tool, not an unchecked, autonomous decision maker. We have the opportunity right now to set the gold standard for ethical AI in medicine, and we need to make sure we get it right before the technology outpaces our ability to control it. Because the last thing we need is a future where AI isn't just diagnosing and treating patients, it's determining who gets treatment and who doesn't. And that's not a future I'm willing to accept. We've covered a lot today. AI is changing healthcare in ways that are nothing short of revolutionary. It's diagnosing diseases earlier, creating personalized treatment plans, monitoring patients in real time, and forcing us to rethink what security, privacy, and accountability mean in medicine. But if there's one thing I hope you take away from this conversation, it's this: AI in healthcare is not inherently good or bad. It's a tool. And like any tool, its impact depends entirely on how we use it. It has the potential to save lives, improve medical outcomes, and make healthcare more accessible. But if implemented irresponsibly, if we don't address security risks, bias, and ethical concerns, we could just as easily create a system that does more harm than good. The real challenge isn't whether AI can improve healthcare, it's whether we have the foresight, the regulations, and the ethical guardrails in place to make sure it does. Right now, AI in medicine is still evolving, and we have an opportunity, a rare opportunity, to shape its trajectory before it becomes too deeply embedded to control. That means holding organizations accountable, demanding transparency, and ensuring that AI serves everyone, not just those with the best access to data-driven healthcare. And look, this isn't just a conversation for policymakers or AI developers. If you're a patient, this affects you. If you're in the healthcare industry, this affects you. If you're someone who cares about the future of medicine, this affects you. AI in healthcare isn't about abstract concepts. It's happening now, and how we respond today determines what kind of medical system we have tomorrow. So whether you're cautiously optimistic or still side-eyeing your smartwatch wondering if it's quietly judging you, one thing is clear: AI isn't going away. It's going to keep evolving, keep improving, and keep raising new challenges along the way. And as long as we're here, we're going to keep exploring those challenges together. And this is where you come in. What do you think? Are we doing enough to secure AI in healthcare? Should we trust these systems more, or are we moving too fast without proper oversight? Let's keep this conversation going. Join the discussion on Human Guide to .ai, or find me on social media at Human Guide to AI. I want to hear your thoughts, your concerns, your optimism, your skepticism. These conversations shape how AI is built and used, and your voice matters. Thanks for tuning in to AI Explored, the human's guide to the future. I'm Jeremy, your resident human navigating the world of AI, one that still occasionally surprises me. Though, thankfully, I've not lost an argument with my coffee maker yet. Until next time, stay curious, keep dreaming expansively, and never cease to explore. Remember, the future isn't pre-written. It's crafted by our collective imagination, one episode at a time.
AI Explore.